question number 21. Here is a 72-year-old man with no significant past medical history, presents for evaluation of fatigue. On physical examination, he appears pale and has a palpable cervical lymphadenopathy as well as splenomegaly. Laboratory testing reveals a white blood cell count of approximately 35,000, hemoglobin is 5.6, and the patient is having platelet count of 86,000. Review of peripheral blood smear shows predominance of WBCs with pale blue cytoplasm, prominent nuclei, and serrated hair-like projections. Bone marrow biopsy reveals the following: 80% involvement by monoclonal population of B lymphocytes with a fried egg appearance, co-expressing CD20, CD11C, CD103, and CD123. BRAF V600 mutation testing by VE1 staining and next generation sequencing is negative. NGS also shows a mutation of MAP2K1. CT of the neck, chest, abdomen, and pelvis show prominent generalized lymphadenopathy as well as hepatosplenomegaly. So what is the diagnosis? Is it classic hairy cell leukemia, or is it variant hairy cell leukemia, or is splenic marginal zone lymphoma, or is it follicular lymphoma? The easiest thing to rule out is follicular lymphoma, because in follicular lymphoma you are going to have T1418 translocation. You're going to have increased expression of BCL2. So this is very classic of a follicular lymphoma. And follicular lymphoma doesn't cause hairy cells. Hairy cells will not be a feature of follicular lymphoma, number one. And apart from that, they are not going to produce that characteristic fried egg appearing cells in the bone marrow also. So these are not going to be the feature of follicular lymphoma. This is something that can be ruled out easily. So remaining three conditions: classic hairy cell, variant hairy cell leukemia, splenic marginal zone lymphoma, all these things can produce hairy cells in the peripheral smear which can be trap positive, plus at the same time they can produce that characteristic fried egg cells in the bone marrow also. So it's little difficult to differentiate them, but so we need to, because it's a question, right? So what about classic hairy cell leukemia? Classic hairy cell leukemia will express CD25, and by default they will be showing BRAF mutation positivity. On the other hand, variant hairy cell leukemia will not express CD25 and they will be BRAF negative as well. And classic hairy cell leukemia will have massive splenomegaly, but they don't have much of lymphadenopathy. But variant hairy cell leukemia can have significant amount of hepatosplenomegaly as well as lymphadenopathy. And constitutional symptoms are quite rare and don't get that much of constitutional symptoms in classic hairy cell, whereas more of constitutional symptoms will be there in patients with variant hairy cell. So that's how you differentiate in exams at least. And splenic marginal zone lymphoma, of course, will not be expressing CD103. Remember, both classic hairy cell as well as variant hairy cell can express CD103. It's a very important marker of hairy cell leukemia, and they will express CD11C also. But splenic marginal zone lymphoma is not going to express your CD103 especially. That rules out your splenic marginal zone lymphoma. And splenic marginal zone lymphoma will not express CD123 as well, which can be expressed by your hairy cell leukemia. So the right answer for this question is variant hairy cell leukemia. The reason is because here the patient is expressing CD103 and CD123. So which means it must be a classic hairy cell or a variant hairy cell leukemia only, but they are not expressing CD25. So it's not a classic hairy cell, and BRAF mutation is negative, which again tells you it's not a classic hairy cell. Remember, 50% of variant hairy cell leukemia will show a mutation in MAP kinase pathway, that is MAP kinase MAP2K1 gene. So there will be mutation there. Almost 50% of the variant hairy cell leukemia patients. So right answer for this question is option B. So this is a table that shows the difference between classic hairy cell, variant hairy cell, and splenic marginal zone lymphoma. It is not that important, okay, to be honest.
Subscribe and press the bell icon so you never miss an update from PrepLadder.